Hello, I'm David Craig, President and CEO of Sarcomatrix. Our team here at Sarcomatrix is tackling a major problem, collectively known as muscle wasting diseases. Now, muscle wasting, or the progressive loss of muscle strength and function, is a core pathology that spans rare genetic diseases like Duchenne muscular dystrophy. It can be secondary to chemotherapy or chronic illness, that's known as cachexia, or as part of the natural aging process, because in our 70s and beyond, every decade, you'll lose 3 to 5% of your muscle mass, regardless of how well we take care of ourselves. So these three markets together are worth well in excess of $18 billion worldwide today. But what we'd like to do is laser focus on our lead indication or our beachhead, which is Duchenne muscular dystrophy, as it's a devastating disease and it's in desperate need for better therapies. Plus, it's a $3 billion market today that's projected to reach $12 billion by 2033. So I'd like to do a short visualization exercise. Think of a small boy that you know. He's a preschooler. He's playing with his friends out back. He has enlarged calf muscles and a waddling gait. He walks on his toes and he falls down a lot. Gets frustrated because he can't keep up with his peers because he's living with Duchenne muscular dystrophy. Now, a few years later, as a fifth grader, walking long distances at this time is very tiring. He's acutely aware that he's different from his peers, and he feels isolated or sad as he transitions into using a wheelchair for the rest of his life. Now, in high school, as a 16-year-old, he's completely reliant on the wheelchair. His upper body strength continues to decline, making self-care activities like dressing and eating very difficult. And his friends are learning to drive. He realizes he probably never will. And finally, as a young adult, by this time, his arm and hand functions are severely limited. His focus shifts from preserving quality of life just to managing chronic pain and fatigue. And he's anxious about his health and he doesn't know how much longer he'll live. And finally, at the age of 29, he passes away from cardiac and respiratory failure. The primary cause of death is in these individuals who have an average lifespan of 29 years. This is the life for approximately 300,000 individuals living with Duchenne muscular dystrophy worldwide. Now, we found a way to activate an untapped biological pathway that stimulates the body's own natural ability to repair and regenerate muscles. The drug, codenamed 969, is a once daily oral drug, and it works by dramatically increasing the expression of a key protein, alpha 7 beta 1 integrin. Now, alpha 7 beta 1 integrin, when we're healthy, increases up to 300% after you tear a muscle fiber. And considering that when we're healthy, we tear between 1 and 2 million muscle fibers every day, myogenesis or muscle regeneration is a constant ongoing process. And this is the primary switch that turns on muscle repair and regeneration. Unlike other therapies that retard disease progression, we expect our drugs to reverse the loss of muscle. So we've measured alpha 7 beta 1 protein levels in different muscle types, skeletal muscle, cardiac muscle, and in smooth muscle. So skeletal muscle, the diaphragm and the leg, we get at least about a 200% increase in expression. And importantly, in cardiac muscle, we see a 236% increase in alpha beta 1 integrin expression. What this means is we can maintain cardiac function for these individuals and likely extend their lifespan significantly. And why we say this is we've actually tested it in diseased mouse models for about a year. And what we found over that year is that the mice live at least twice as long as the controls while maintaining cardiac function and muscle strength. Another study we did in golden retrievers. So the golden retriever dog is the gold standard when studying Duchenne muscular dystrophies because just like humans, they get Duchenne muscular dystrophy or the dog variant thereof. Now, we studied this in old dogs that were really seriously ill. And here's an example. Max was immobile and he had an enlarged tongue and he couldn't eat. And the veterinary clinic that we were doing the work at was ready to put him down. We put him on the drug and Max, after 4 months of treatment, is up, walking around, eating normally, wagging his tail, and is not fully recovered because he still has Duchenne. You can see his gait is a little bit wobbly there, but that's what they look like when they're as healthy as they possibly can be. But we're very encouraged with the success that we saw in this dog model. We're also leveraging decades of research that have already been done by the Birkin Lab at University of Nevada. Based on 8 million non-dilutive grants, what they've done is all of the bench studies, the carcinogenicity studies, the hERG studies, along with small animal mice, long-term, short-term studies, rat model. We've also studied it in dogs, as I mentioned, and we recently completed a study in primates to estimate what the human dose would be. So we're firmly on track to enter first in human studies in 2026. Bottom line is we need the money to move forward. Now, our once daily oral drug is clearly differentiated. Our competitors are very expensive, in the millions per year. So let's say that we enter the market at a reasonable price of 250,000 per year. Because we have such low cost of manufacturing, our margins are very high, and we can return a nice return on investment to everyone. Our drug should be effective in all 30 types of muscular dystrophy, not just Duchenne. And Duchenne represents about 25% of all muscular dystrophies. And then there's 10,000 different mutations today that we know of that cause these muscular dystrophies. Our drug should be effective in all types, not just Duchenne. I mentioned that we're going to be effective in cardiac muscle, potentially extending lifespans. We are effective in smooth muscle also, which helps with gut motility, swallowing, and the ability to digest food, etc. It's a once daily oral drug, easy to take. It doesn't require 3 months or 3 weeks of hospitalization for gene therapy, nor does it require weekly home healthcare visits for an IV administration. We've designed a clear, efficient, and accelerated path to regulatory approval. We're scaling up manufacturing at this time and have material on the bench to start our studies. And I mentioned before that we completed the majority of our non-clinical studies, and we see two major inflection points. The first inflection point, exit one, is after we finish the phase one healthy volunteer and then get early results from a phase two diseased individual study. And then a second exit would be if we were to take the drug all the way to the market. Now, market conditions right now are pretty tough. So the idea that we can raise $400 million and take it all to the market, I think, is a stretch. So our strategy is to complete the phase one healthy volunteer study and the phase two early efficacy study, and then out-license it to a strategic pharma company. We estimate an ROI of at least 25x at exit one, and that would be in the fourth quarter of 2027 or early 2028. Now, if we look at valuation models, there's three comps in the market right now that are very predictive of what we could do. Regulus, IDX, and Janana were all valued of at least $1 billion, and they were acquired by large pharmaceutical companies. These comps are rare disease drugs with similar pricing models and are very predictive of what we would expect on evaluation from a comp perspective. And then the model that pharma usually uses is a peak sales model. So they'll put together a forecast and then multiply the peak sales by 2 to 3, and you can come up with an estimate there of $1.5 to $2.25 billion based on reasonable forecasts. So how we come up with a 25x or greater return on your investment in 2028? It's cost about $10 million to get that phase one study and early phase 2A study done. And if we value the company at that exit at 250 million, very conservatively, that's a 25x return on investment. But I think you could probably expect a valuation on exit of about 500 million, which would be a 50x return on your investment. We've got a great scientific platform, and it's only as valuable as the protection that we wrap around it. So we've got 75 patents issued that covers our small molecules and our proteins, all of our programs. And it's very robust and multi-layered, including accelerated approval, orphan drug status, method and method use patents and utility patents. The team that I handpicked is purpose-built for success. This leadership team, has more than 130 years of collective experience developing and commercializing more than 20 drugs. We've got great world-class business and science advisors on board. And personally, I've been really fortunate. I've worked with founders like George Rathman at Amgen when the company was about 100 people. I helped him scale his company to thousands of people, employees, and then launch his first drug, Epogen. Did a similar thing with John Martin at Gilead Sciences, and most recently at Portola Pharmaceuticals. We did this with Bill Liss, scale his company, and we sold that company for $1.4 billion. We have excellent traction to date with $8 million in non-dilutive NIH grants paying for most of our research. The round that we have open right now is a $5 million seed round under a Reg D 506C. We have $1.5 million committed. We're offering a priced equity round with a pre-money valuation of $14.5 million. And what these funds will do is support regulatory, manufacturing, and clinical development. We have a very low overhead model as we go forward. Keiretsu Northwest Rockies has completed due diligence, and we have a syndicate in place. And in addition to that, the Muscular Dystrophy Association of America did a technical assessment, and the takeaway there is you're ready to start first-in-human trials in healthy volunteers. So what's our ask? Invest now with this low pre-money valuation of 14.5 because we suspect that at the end of the year, when we complete our current valuation, it's going to bump up to about 28 million. And invest in this opportunity so that we can advance this drug forward. I have personal experience with Duchenne and other muscular dystrophies. When I started this 3 years ago, my niece, Chloe Nickel-Craig, was still with us, but unfortunately, on February 20th of 2024, she passed away from respiratory failure, cardiac failure. I'm very engaged with the community and know it's needed, and this drug will be critically important to help these patients. So invest in the company. You'll likely get a very good return on your investment, and you'll be helping thousands of people with muscular dystrophy today, and possibly as we go forward, you could help yourself in the future as you get age-related sarcopenia. Thank you for your time. Have a good day.